I'd like to now introduce our two speakers for this session, Cheryl Taylor, Mary Ann Sears. Cheryl is the Director of RCM Consulting at Cognizant RCM with a background spanning in operations, IT, client management. Mary Ann is the Senior Service Line Leader, Patient Access Services at, for Patient Access Services? For Patient Access Services at Cognizant RCM with over 15 years of experience across front-end rev cycle. For their session, 2024 Revenue Cycle Rollercoaster, put your hands together for Cheryl and Mary Ann.
Well, thank you for that introduction. And thank you for joining us this afternoon. As he said, I'm Cheryl, this is Mary Ann, and so we're going to be your guides this afternoon talking about our favorite subject, which is revenue cycle. So here's our agenda for today. We're going to have some learning objectives. We're going to talk about the industry landscape, patient access optimization, all our favorite buzz of generative AI and automation, and then just some key takeaways at the end. So what we hope that, there's some nuggets that everybody will take away are, the impact of denials, why prioritizing patient access is so important, how generative AI and automation can function and benefit us in RCM, and then just tying those all together as a bundle of that strategy. All right, so we're going to start with a survey. So if everybody can pop out their cell phones and take that quick little quiz, let's see what everybody thinks about these two questions, like what % of initial claims are payers denying on average, and then what % of denials received are being appealed and resubmitted on average. Okay, everybody got it?
I'm going to toggle over. The QR code will be back up if you need it.
All right, interesting. One's creeping up, one's going down.
Competition.
All right. So let's see how those answers go. Okay, can you put it back?
I'm just going to go to the second question here.
30%. Okay. So let's get cracking and see how everybody did. All right, so we're going to get to your answers in a minute, but let's talk about those trends from 2023 and what are we seeing coming into 2024. So I'm sure this is no shock, but the two that are heavily correlated are the staffing shortages and those industry costs. The costs of labor have gone up. The staffing ability has gone down. Trying to fill those seats have become more challenging, which is why we're seeing, that 63% is now outsourcing, right? Because we just simply can't get the bodies that we need in order to fulfill those roles. The other part that we found interesting is that we found a 10 to 15% rise in denial claims. On average, it's 5, but depending on what industry, it's much higher than that. So the other component that we're seeing for 2024 is obviously that trend and uptick in technology, right? And so we're going to talk about that during our automation and AI because Cognizant actually did a survey. And so we wanted to share that with you just so that you could see what others in the industry are thinking and focusing on in these areas. So how is AI and automation affecting what we're looking at, right? So to improve that patient experience, optimizing our revenues, and data-driven decisions. Some of the areas that we're still struggling in is how do we get all of the disparate systems where data is happening to come together to tell us a clean, concise story. We do a lot of denial assessments, and I can tell you right now, just even capturing all the data points to give that cohesive story is a challenge. And when they have to get us data to do that, I think it really drives home when we're able to showcase those kinds of outcomes. So when we think about the industry landscape as a whole, what is the most interesting is that the Pacific has the highest denial rates, and then the Southern Plains have the second, right? But when we look at one of the statistics that's interesting is that 60% of denied claims never get resubmitted. One of the clients that I was working with, he used to actually work, I call it the dark side, at an insurance company, and his manager told him, hey, I need 1 in every 3 claims denied. And he's like, for what reason? And he said, because it saves me $10 million a year. Because most people don't come back and actually fight for their claims. Why? Because remember that staffing shortage and cost for administrative burden? Those are the reasons why. So I love level setting a presentation with data because I think that it's important for us to understand, yes, we all know, we read, you know, HFMA, we're reading everything that tells us that this is happening. Our own data is telling us that this is happening. But as you can see, year over year, it is not getting better. And I can tell you, as Cognizant has 75 to 80% of all payers in the United States as clients, they are leveraging the technology of automation and generative AI at a pace that is definitely outpacing what we are doing on the healthcare side. So let's talk about where people are thinking about automation from a data perspective and what those outcomes are. So we have people who are partially automating, no automation, and then people who are planning to automate. But what does that do for those cycle times and those outcomes? Well, 15% of the medical claims, they're initially denied. Sometimes it's higher, depending on the actual entity. We've seen it as high as 25, 30%, and we've seen it lower. I think the lowest that I've seen is about 7.5%. So we do, as I said, a lot of denial assessments. And what we are seeing is very consistent with what you see here. We are seeing that I would say out of the last 100 denial assessments we did, 98% had their largest opportunity in the front end, which is what you're seeing here. You know, when we think about how to devise where to put our funds, we know that most organizations put the majority of their funds to that back end, right? That's like pushing that boulder up the hill. And so what would it take for us to reimagine? Yes, we all focus on the patient experience, and Mary Ann is here today as my partner because I am a firm believer that the more you focus on how we engage patients from the onset, matters how it flows through with denials, with revenue. It all ties together. And so organizations that heavily focus on that really see the difference in this. But across the board, I can tell you that eligibility and authorization continue to be the bane of an organization's existence. So much so, when I say eligibility, they're like, but we're checking. We know they have insurance. And I'm like, okay, there's multiple levels to are they eligible? Okay, they have insurance, they don't have insurance. Do they have a secondary? But are they eligible for the service? Have they had too many of that service, right? And so these are different levels that we have to start to get to in our processes so that we can communicate effectively with our patients. So as you saw on the last slide, 41% were those front-end issues. 22% was the eligibility, 13% was authorization, and 6% was medical necessity. If we were able to, as healthcare providers, really start to focus on that, and we are at Cognizant working on things in that genre and in that vein of focusing on authorizations. Why? Because the medical policies actually hold a lot of information for us. And so it's really important that we take that into consideration in the multitude of levels. So when we think about how we can strategize, there's two big components we think about. We think about those comprehensive reviews and then those functional reviews. Those comprehensive are our policies and procedure. I know that it might sound tiresome, but people, process, technology really do matter. And we have to constantly be rethinking about how we're leveraging each of those things and what strategies we have in place in order to facilitate better outcomes. I can tell you firsthand from a consulting perspective that a lot of times we think what's happening is not what, it's just not what's happening, right? Often as leaders, we don't have the ability to spend as much time as we can or should really understanding is, did the policy I put in place, did the procedure that I put in place, is my technology fully built out the way that it's supposed to be? Are we using it the way that we're supposed to be using it? Right? And so those are the things that we need to be doing from a comprehensive and a functional review, is really getting in there and understanding if what we put in place is actually taking place. So often we are told in revenue cycle to do more with less. Hands down. I'm not sure I understand that philosophy, but it is what we're told. We don't have any more in our budget, but we need you to do X number more claims every day, even though there's a set amount of working hours, right? So we try to encourage our clients to take a different approach, which is at the end of every year, I like for my clients to do a postmortem, I call it, on their write-offs. What did you write off this year? How could they have been prevented? And we turn that into dollars, right? And we're like, okay, if you had just done X, Y, and Z, instead of writing it off because there's no budget, this is how much more you would have made, this is how much more you would have saved, right? So we actually take a different approach. Yes, you have your team, but there's SMEs that can come in and help you, temporary. And then there's other teams like, temps or, we call our SWAT teams where they come in for very short periods of time. Let's say level set your, 120 and over, 180 and over, clean that up in 4 months, and then, give you some feedback on hopefully how to reduce that going forward. But it takes more than just your existing team. And yes, we're building technologies, but we don't have all of those built right now that we need. So how can we collectively think about reducing our denials and increasing our revenue and stop burning out our people? So there are 262 billion in denied claims every year. We get to about 40% of them. If we were to increase that to 60%, that would be an additional 157 billion within the organization. So why is it important to do that post-mortem every year? Yes, it can be painful. You can't point fingers, but if you truly understand what your data is telling you and you do the math, you should be able to come up with a better strategy for the next year on how to leverage additional people, leverage additional resources to increase your revenue. This seems like a no-brainer, having KPIs, that North Star that we go to, that goalpost that we want to meet. I think you would be surprised at how many people don't strategically understand where they are and then putting things in place to get to that next goal. And a lot of times we don't think that way. We think, okay, this is best in practice, which is, let's say, AR over 90 days. hospital physician 10 or 20%, right? And then we see that number and we go, oh my God, I'm at 30%, what do I do? Well, you can't boil the ocean, can't eat an elephant all at once, right? That whole theory. So you have to put strategic goals in place, but you have to understand why we're not meeting it to begin with. So here's just some samples that we use in our denial assessments and things that we like to follow. So I like to see volumes of denials quarter over quarter. It helps us, yes, you want to see them more frequently, but it also helps us to understand and be able to go back to our clients and say, hey, we see something that happened between this queue and this queue, and either something happened or they're not aware, and then we drill down into the specifics of it, like by payer, by location, by CPT code. And you would be surprised how shocked people are at the kind of nuggets that we can pull out down to the CPT and ICD-10 level. And then we do it by reason groups. We do it by procedure codes. And then often what people do is they'll do a top 10, which is great. You should, right? You want to focus on your top 10, but then you need to aggregate that even more. So just like in that other slide where we aggregated to front, middle, and back end, you want to do the same with your CPT codes. And because a lot of times what you'll find is when I was VP of Revenue Cycle, you know, I would have CFOs go, I'm losing money quarter over quarter, what do I do? And so I'd have to aggregate reports in a different way to actually pinpoint where the leakage was coming from. And so like in some instances, we can identify that there's a massive problem with E&M codes or with AWV codes or a bunch of different things that are specialized within an organization. But these are the types of things you have to think about it not just as a generic, oh, here's my top 10, let me start working on it. But are there ways that you can group your codes together or group your denials together by where they're happening in order to, you know, have more impact versus just going after one thing. All right.
I get to be the fun intermission here, I'll call it. So as Cheryl said, denials are pointing, nearly half denials are coming from front-end processes, right? So let's look at the front end. I like to look at patient access, maybe from a little bit of a different lens. So I also have a QR code. My questions are maybe not as rev cycle related, but if you want to scan this code, there's 2 questions here. The first is true or false. Globally, do more people own a mobile phone than a toothbrush? True or false? And then number 2, just to put ourselves kind of in the patient's shoes and get ourselves geared to kind of look through that lens, what dollar amount, this is from a patient perspective, what dollar amount constitutes a quote unquote expensive bill? What bucket would you use there? So let me see if I can figure out the mouse here. All right. True or false? We're a split team here. This one's hard to manage. Okay, someone tiptoes over the edge here saying true. Oh no, now we're back to 50-50. Well, I will tell you, it's a hard one to believe. The answer is true. More people globally own a mobile phone than they do a toothbrush. Priorities, right? So, second question, what dollar amount constitutes a quote-unquote expensive bill? And we've got a good lead here, at $200 to about $1,000, and that is the right answer. So right in that range. It's a wide range, I will admit. But some people may look at $200 and say, that's not an expensive bill. I'm thinking of something that goes into the thousands, right? Goes over that 4 digits. So yes, patients would say anything between $200 and $1,000 is an expensive bill. So, get my PowerPoint back up. So what are these questions trying to get us to think about? Well, revenue cycle is that first impression, right? And Cheryl always says, I love this saying, garbage in is garbage out, right? All of the emphasis we put on middle and back end of rev cycle, all the automation that's being built, it's only as good as the data we're feeding into it, right? So this first impression has quite a few impacts to the processes, but I also want to talk about patient access and what does that mean for the patient experience. Because we also pointed to staffing shortages being one of those big barriers for us. And oftentimes, front end, because we have that staffing shortage, we hire a lot of entry-level people into that position, right? So they're starting accounts that are going to lead to dollars and accounts that are more than a mortgage. But you have someone entry-level who has no experience in rev cycle leading that conversation with patients or inputting data, and they don't know the impacts that it's going to have at the end of rev cycle. So that first impression is really important from the patient experience too. Building trust with patients has that impact on rev cycle because it's going to lead to that patient loyalty. The word of mouth advertising, that trust is important to say, I trust the estimate you gave me is right. I trust this bill I'm getting is correct. You know, when they have that experience of, I got a bill and it was wrong because it was coded wrong, or whatever past experience the patient's had, you've lost the trust, you're probably going to lose their loyalty, and you're going to lose the loyalty of their immediate circle because that word of mouth advertising. So reducing denials is a great way to start to build that trust back up. So when we talk about trust, 50% of patients say that a bad experience digitally with their provider would ruin their entire experience. So they can get the best care from the best physician or the best hospital system, but if their patient portal wasn't right or their payment experience, whatever digital interaction they're having is not the best, they might opt to go somewhere with less care because that priority of what's my experience and what's my interaction with my care provider is so important to them. And so much so, 80% of patients said they would switch their provider just for that convenience of that digital access and communication. So there's kind of like, there's rev cycle. I always like to talk about a patient experience cycle that just lays right on top of the rev cycle because every experience along rev cycle is just a kink in the chain. And if we ruin that experience at one point, it can ruin that entire cycle. So start with that great communication on the front end with patient access. What's the ease of giving my information? Going back to that staffing shortage conversation, patients are an extension of a partner for us. The last decade's really brought about patient portals, patient self-serve tools. So we're not necessarily hiring more staff, but we can actually leverage the patient's interaction. They want to be engaged, and we can leverage the patient doing some of that data entry for us to, number one, get better data input, because it's their information. They're probably not gonna make a typo on their name. So you've got that data integrity from the patient, but then you've also got them, you're leveraging them basically to fill some of those staffing gaps that you have. So start with that good communication, get the patient engaged. And patients who are more engaged and communicate better with their providers actually are proven to have better outcomes clinically as well. It goes back to that building the trust, right? They've got a good rapport with their physician. They're following all the care plans that they're supposed to because they are engaged and have that trust. And so better clinical outcomes means they've got a good experience. They're going to return to that health system or their provider. They're going to tell their friends and family, hey, go to hospital ABC because this is the great experience I had. And so it's just, it continues that rev cycle circle for you. And that patient experience piece is definitely driving a piece of it. So if patient satisfaction is so important, what are patients asking us for? And patients are telling us, you know, more people have a phone than a toothbrush, right? So they want to be engaged. They have the tools in their hand. How many people, show of hands, have a cell phone with you right now within arm's reach? How many people have more than one cell phone within arm's reach? Okay, a couple people were shy, but they admitted it. Yeah, you know, you got your computer, your cell phone, maybe you have 2 cell phones. So this is just part of daily life, no matter what industry we're in, right? This is how consumers are connecting with the services they get, and healthcare is no different than that. So they're asking for things like pre-service. What am I gonna owe? How can I make payment arrangements? Can I do it digitally? Can I do it on my own time? I have a 7-year-old. I do a lot of my setting up doctor's appointments at 8 p.m. after we've done bath and dinner, right? It's not a 9 to 5 business anymore that we're interacting with our patients. So they want to be connected, but it's not necessarily on that 9 to 5 timeline. And they want to be able to connect different ways. We're going to dive into a little bit what are those preferences for patients. There's not a one-size-fits-all. No patient is exactly the same. We've got a wide demographic. And so how do we really lean into what's the generation of patients we're serving? It may look different for everyone sitting in the room, but really understanding that will help you figure out what's the best way to connect with my patient, and you can make a plan for there. So understand your audience. I think these are, I'm going to put a disclaimer, these are generational stereotypes, if you will. So the top line here tells you the generation, the age, or the year range of when they're born. Right underneath it is kind of, this is from a survey of how they identify themselves. So this is kind of like the generation saying, these are the attributes about me. So baby boomers are kind of known for, and they self-identify as having this reputation of, I'm really loyal, what's always worked, I'm going to keep doing. Sometimes that brings a reputation for being challenged with changes. And so baby boomer generation may be, folks that aren't necessarily comfortable with some of those self-serve options I've been talking about. Their preferred method communication is right below. They prefer more of that face-to-face touch, right? Or even just on the phone. I want to talk to somebody. And so if you deal with that patient population, and that's the majority of your population, then yes, your plan might look different to communicate with patients. But we know that the next generation entering healthcare continues down the spectrum to more so millennials and now Gen Zs, right? So we kind of see the evolution of technology within this timeline of generations as well, going from face-to-face to, okay, now I can be on the telephone. Our Gen X are very resourceful. The first cell phone, I had to Google this right before to make sure I had the date right, 1973 was the use of the first cell phone. And so that's right in the middle of Gen X there, right? So now they're more online, or maybe even mobile communication as their preference. 1994 was the first smartphone. So that's right in the middle of our millennial generation here. And millennials are really known for career, work, being connected mobily really drives their sense of self. I will self-admit, I'm a millennial. My career and my work, it ties back to who I am as a person. I really identify through it. But I work outside the 9 to 5. I have everything on my cell phone. I prefer to go through text or email to communicate. But I'm now at the age where there's a generation coming up behind me, Generation Z, right? And they're the masters of multitasking. They're known for that. So they're more of, kind of getting back to face-to-face, but digitally. I like my FaceTime. I like to do video calls. And so now we've seen kind of an evolution to telehealth and things like that. So the technology and the generations are so tied together. So understand your audience, know who your patient population is. Because again, the point is you want to connect to your patients, and first you have to know who's the demographic I'm talking to. So from there, we have to kind of self-reflect. Are we on the same page as our patients? I had to teach my husband this rule. There's the golden rule, which is treat others the way you want to be treated. Yay. Yeah, and then there's the platinum rule, right? Treat others the way they want to be treated. And I always use the example flying because I travel a lot now. When I get on an airplane, I want to put in my headphones or read or sleep. I don't want to have a full conversation with my husband next to me. But my husband gets on the airplane and he wants to chat to people. He wants to know where they're going, what they're doing, right? So everyone's got their preferences, right? So, we have to think about moving towards that platinum rule of treat patients the way they want to be treated, understand your demographic and their preferences. And I think a great way to highlight this is looking at a piece of patient access, which is the patient payment piece. So when asked if providers thought that they provided adequate information for the medical bills to the patients, 96% of providers said, yes, I do. But then this question here to patients says, considering your recent payment experiences, rate the industry from easiest to not easiest, right? And 8%, only 8% of that survey said healthcare was an easy experience. We got outranked by banking, oh my gosh, retail, grocery. I think we know that those industries have evolved pretty quickly, and we're playing catch up to those industries. But the point is, what providers are saying and what patients are saying, we're not aligned. We may think we're doing a good job, and when asked, we might say, yes, we're doing great at this piece. We've We've moved to patient portals, we moved to digital payment options, we're doing great, but patients are still saying it's not keeping up compared to other industries or to other expectations. So you can kind of take that mindset and look across all of patient access. So when you're talking about patient engagement, yes, there's lots of portals out there, but really assess, is it meaningful use for your patients? Are they able to get their patient estimates? Are they able to make the payments the way they like? There's a lot of patient portals, but you can also set up text to patients, right? And so there's lots of different ways to communicate with patients. The portal's leading the way, but just step back and reassess, is that the right way to connect to my patients? And same thing with the registrar workflow. Like I said, you can leverage patients to be registrars for you. All that pre-registration they can do online. They can do the work for you, but then also creating that option for the patient to do it also means we're bettering their experience. I always like the ask once policy, however you put it into place, but basically, if I go to my doctor's office, I don't want to have to fill out the same paperwork every time. And I have been to a provider like that. I was just there 2 weeks ago, I'm coming for follow-up, and I have to fill out an entire registration form. Again, that shouldn't be the case with our patients. And so how do we start to pinpoint where those areas of inefficiency are? And with the evolution of patient portals and self-serve options over the last decade, I think there's been a curtain really pulled back on front end and registration. I think historically the thought of patient access is, oh, I'm going to go sit at a booth with a registrar, they'll ask me questions and type it in, and that's what registration is. But we really see this like tornado effect, this web of madness that is patient access, and it constitutes all these different things. And everyone does it different. They do it at different points of time. I've had the experience where I'm getting called to do a price estimate, but they didn't verify my insurance yet, and they've got my outdated insurance. So there's kind of prerequisites along the way where you can really start to streamline your processes so that we're not contacting patients before we've done our due diligence to make sure the information we have is already accurate. And so how do we kind of move forward from this web on the left to a more future state in the right, and that goes back to the process piece. Technology is certainly going to help with streamlining because it's going to help us automate. It's going to help us consolidate steps together. If I'm verifying my benefits, can I find a tool that verifies benefits in a way that tells me the service level of what they're eligible for? It's bringing back information that's going to help me with the price estimate. So these don't have to be siloed steps. Everything can start to consolidate with technology, but it's important to look at the process itself, because just sticking technology on top of a process where it's siloed already is not going to help get to the streamlined state. So how do we measure it? Patient access, patient experience, it seems like one of those, it's feelings, right? It's not as much data as Cheryl gets to do the data. I feel like it's easier because it's numbers that you can look at. Patient experience is a little bit harder to measure. So how do we start to measure it? Well, we can look at the financial piece for providers, but then also look at what's the benefit of a patient experience improvement as well. So these numbers may not be new to you, the impact to the provider, right? We're looking at patient payments, again, for example, the box on the left here. When we communicate a patient's estimate before their procedure, your chances of collecting that patient's liability in full goes from 30% to 70%. That is a huge increase, right? So simply starting the communication on the front end, building the trust with patients so that they trust that estimate and they're willing to pay it, can also have benefits. It increases your pre-service patient collections by 10% as well. And then not just for the patient payments, but insurance and payer payments as well, right? The longer an error goes into rev cycle, the more it costs to fix it. On average, a rejected claim and cleaning up edits costs about $25 per account. Any kind of denial costs about $100 on average to appeal. Not to mention it goes so far, you've missed timely filing or whatever the case, and now it's a complete write-off. So shortest distance from point A to point B is a straight line. That's where we're trying to get straight from registration to payment in full, and we get there by having data integrity right at that front door. And so measuring that improved patient experience, 41% of patients say that they do not get an estimate up front. And it's more than they expected when they do get that bill. I think there's still an educational piece to patients where I've even had patients say, I already paid, I pay my monthly premium, and don't even understand there's a patient liability after that. So there's a knowledge gap, I think, amongst patients, and having that conversation starting at pre-service or starting it on the front end, if you're thinking about emergency room patients, having some kind of conversation up front in the ER to explain benefits to patients just so they know what to expect, can lessen the blow of getting that bill after the fact, right? But 72% of patients say they're still confused by their explanation of benefits. The way they receive, even from their payer, their EOB, saying here's what the charges were, here's what the insurance paid, here's what the patient owes, they're still confused about that. So we can't always change the actual cost of healthcare. We can't just go out and say, okay, well now surgeries are only going to be $50 for everybody. We don't have the power to wave that wand. But what we can do is improve that experience by providing some transparency to that pricing and patient experience. But again, decrease those billing mistakes. If we put an insurance in wrong, we know if we're missing a middle initial for Medicare, it's going to cause an issue. If we make a typo in the name or the birthday, we get into those denials that we only appeal 40% of them. Was that the percent? 60%. So we get into that area where just a typo on the front end now leads to either patients getting a bill by error or getting a bill for more than what they owed. And some patients never even realize they're paying more than they should have because they're not knowledgeable about full rev cycle. So with that in mind, patient experience, how can we leverage technology to start to improve and streamline that experience?
All right, last one.
We promise this is the third and final survey. We're just making sure you're awake after lunch. Oops. There you go. I don't have the button to show the answer. You know the answers, right? Cheryl?
They're in the presentation.
No, this is the results.
Yeah, I know.
Speaking of technology, see if I can get it to work for us.
So yes, it's the top one and the bottom one. It's the limited budget and then uncertain ROI. Well, you gave people a lot of credit. But I would say that, yeah, it's 1 to 2. Or the not started.
There we go.
All right, cool. All right, so this was the survey I spoke about earlier. So Cognizant sent out we queried 300 hospitals and health systems. As you can see, we touched on C-suite, IT, and then we touched on those business leaders, people who are kind of in those trenches day to day, working, just so that we could better understand based on, and here are the different sizes of those organizations as well. And the questions had to do with more towards, where people are, what they were thinking for the future for their organizations. And so here's where we landed on the, as you guys put the 1 to 2 functions, and it's not necessarily in RCM, it could be in HR or finance or other areas of the business. But you were correct, it's 32% who have already started the journey. A small amount have not started, but I would say most folks are struggling with getting it launched into RCM and seeing those outputs. And then over to the left there where it talks about how important is it? I mean, I think everybody realizes at this point that it is imperative, right? But I feel a lot of people don't want to be like that guinea pig. They want to see things working and see the function. They want to see the ROI. I had one CFO who's like, I want like a 5 times or I want a 10 times ROI. And I said, but can we talk about the negative that's happening from that function and how we can at least get it more, positive and steady state? So I think that there's a variation in what people are expecting right out the gate from these functions. So I like to kind of level set with what each of these things are. I think that we're just kind of, lathering over the top of just using the word of AI for everything. But AI isn't everything. And there's different components that technology would leverage in order to functionally help a specific area. So let's take authorizations, for example. And I have a slide, and I'll speak to it. But what I am finding is that people don't have a proper journey map. They're not having the correct infrastructure. And what they're doing is the IT guys are getting together with these groups of people, and people are like, oh, this is my biggest problem, fix this problem, fix this problem. And they're like, okay, but they don't understand the whole infrastructure, why it's maybe not working to begin with to actually determine. So we have these different areas. We have the RPA, right? And that's just a repetitive task. So one of the things like claim statusing is just go out, get it back, tell me if it's on file or not, right? And then we have our ML, which is, the ability for the technology to ingest large data sets. We have generative to agentic AI, meaning that there's between the human and these different areas. So for example, analyzing payer contracts, right? What are they, like 30, 40, 50 pages long, lots of stuff buried inside of it. So having that kind of technology that can ingest those documents and come back and say, hey, here's your opportunity here based on what's happening with this payer within your system. These are things that you might want to look for, right? And then last, we have artificial intelligence, which is the ability for that technology to actually learn, right? And some of the workflows in RCM actually require all of these technologies to have it flow through and actually work. So there's a new S-curve forming. So if we look at kind of the history of where we started with, creating CBOs and then offshoring and then nearshoring, and then we went to, Lean Six and, tech augmentation. Like we've had this journey, right? But now there's a new journey happening where there's technologies and things that are growing in order to help us get further in our journey of reducing what's going on. Because what has happened in our original S, you can see by the denials year over year, what we're putting in place, it's not working. If it were working, we wouldn't be here. We would have the revenue that we need. We wouldn't have the issues that we're having. So here's kind of that generative AI value chain, meaning things that are low are things that like bots can do or large language models, right? But where is AI really the places that we should be thinking about and focusing on? And so we've outlined here I'm sure not absolutely everything, but close to everything. And so this kind of helps you understand, where can generative AI have the most impact in your revenue cycle? Now, I work with our, AI and automation team. And so are there differing opinions? Yup. But depending on the infrastructure of an organization. And I don't think that that's talked about enough. Everybody gets excited about the technology. I mean, I'm definitely excited about the technology, but you also want to make sure it's successful and that people do get the ROI for it. So you have to make sure that the infrastructure exists for it. So this is the automation component. I met with a team, large health system, and they wanted to talk about automation. SVP says, Cheryl, we are neophytes. We are just starting this journey. I don't want anything too complicated. And I said, okay, great. So show me the journey map that you've created. He's like, okay, well, we didn't do all that. What we did was we picked our worst denial, which is not uncommon, and we're solving for that. I said, okay, let's solve for it. Where did you start? So they started in Horizon 4. So what we've done here is we said, hey, let's start easy, which is Horizon 1, and then as you get it implemented, see the results from it, it's working, then we move on, right? And this is the automation component. So they picked authorizations to start with. And so we said, okay, but you need automation, you need ML, and you need AI. Because if you think about how authorizations work, right? Dr. Chart says, hey, we're just gonna, for the sake of this conversation, I want an MRI, right? Or a CT, we'll pick one of those. So now somebody has to go get that, right? But there's the technology now that can take that request, scrub the record, upload the request with the records, come back, say, yes, it's authorized. But how often do we end up doing things, like even in surgery, that aren't on our authorization? So then our authorizations get denied, our claims get denied because we didn't update our authorizations, right? And so we need that feedback loop in our technology to come back through and make sure that what we have authorized and what we submitted on a claim are matching and going out the door. And so when we think about these technologies, that's what we talk about in that roadmap. Now, maybe we're not going to do all of that automation at once, and that's why you journey map it. You say, okay, we're going to automate this, or we're going to do Gen AI on this. These are all the steps we're going to do, and these are the components we're going to get to. But you have to start somewhere, and what we are finding is that most people are trying to start in the most complicated, and what they need to do is build that strategy up. So some interesting things that are coming to market that are pretty exciting are the predictive analytics. Right? Which is, my claim hasn't even gone out, because let's face it, once it goes out, we're fighting a whole nother battle. We're fighting timely filing, we're fighting timely filing for appeals, because there's both. So there's a lot that's going on. But what if we can now determine, before that claim goes out, right, what is the propensity that this claim is going to get paid? Well, your clearinghouses have tons of data, right? They have your 835s, your 837s, they have your denial codes, your denial reasons. They have so much of your information, right? So now we've got that. And so these predictive claim analytics, this is our journey, right? We started with actual denial codes, and then we moved on to work queues, and then we moved on to, manual root covering analysis. But now we're coming to predicting before it goes, which is huge. Sure. Oh, sorry. Right, and so when we think about preventive medicine, it's the same with this, right? So instead of the claim going out through the clearinghouse, it's now going to run through a cycle of saying, okay, this is your payer, these are your CPT codes, it now has all this information it can spit back to you and say, you have a 20% chance that this will be denied, or you're going to get, this is a 90% chance this is going to be denied, right? Now you have an opportunity to step back before that claim goes out the door, analyze what's wrong with it, understand those feedback loops within your organization, because it may deny and it may be too late. But at least you're going to start to learn so that you can get more preventative in your approaches. But this is that journey, right? So the information gets ingested, it then follows this cycle, again, taking in, it leverages ML, right? Where it's taking all of that data together and bumping it up with that claim. Good.
I guess be the big finale. So what's our takeaways here, right? Really, if we had to sum it up, proceed thoughtfully. I had said earlier, technology, Cheryl did a great job of highlighting all the technologies out there, everything that's exciting and on the horizon, but just technology on top of broken processes, or technology manned by or analyzed people who don't have the right experience, it's gonna be just a Band-Aid, right, on top of the problem. So what should we be thinking about? Number one, data. I think you saw from the first, probably third of the presentation, data, right? The data is out there. How do we bring it together? Are we looking at the full picture, or are we just looking at our piece of the pie? And so it's critical really to kind of understand where the denials are coming from, what are the root causes, but not just from the silo of here's the service that I'm in, looking at the whole rev cycle. And so we can't fix what we don't understand. We have to have a clear picture of it. And so data can be manipulated to show whatever story you want, but really kind of challenging ourselves to say, let me look at the data and let it tell me the story. And the way you do that is bring it all together into one picture. And then understand, what are those denials really costing you? Because we have that question, what's the biggest driver of, why we're maybe scared to implement technology or implement changes, and the cost of it really scares us. But understanding, if we don't take action and invest in the right place where the data is pointing to us, what are we truly losing on that back end? What is that return on investing in the right areas? And then again, understand your audience. So know who your patients are, know how they want to communicate to engage with them. Don't do the slot machine model of just putting a bunch of things in and not being able to really measure the impact of each one, because you might put something in place and then step back and say, that was not a meaningful change. And you can pivot from there. But if you put all these things into place and aren't really measuring what's the impact of this one change I've made, you don't know where you're getting that return on it, right? So understand your audience, know where you're gonna yield that bigger return. And then bring all the pieces together. So again, people, processes, and technology. You have to analyze the data and the remediations to ensure that you're really reaching the right outcomes. Get the right KPIs in front of you that are really pointing towards the solution. And then again, technology is essential, but you cannot just lay it on top of a broken process. So bring in that kind of consultative hat to looking at your denials and saying, where are we gonna start? What's our target? And working towards it. So Cheryl, any other thoughts? She left me up here solo to end it. So thank you, I appreciate it. Are we opening for questions, or were we doing questions at the end, or are we good? Okay. I think there was only one mic. It was, yeah.
Is this in the?
No.
This one's just through them.
All right.
Are there? Oh, you got the mic. Lovely.
Oh,
Are there
yeah.
questions? Anyone for Cheryl and Mary Ann? No.
They're like, it's almost 5 o'clock somewhere.
Yeah,
It's
absolutely.
almost 5 o'clock here, so yeah.
All right, let's have, please, a wonderful round of applause for our presenters. That was awesome. Thank you so much. Oh, those are